Good day, everyone. Today we will discuss about the person-centered theory of Carl Rogers. In this topic, we will be discussing the life of Carl Rogers, the person-centered therapy, including its timeline and key concept. For the intended learning outcomes of this discussion, first we have differentiate existential therapy from humanistic therapy. Examine the evolution of person-centered therapy over time and understand the person-centered therapy through its key concepts. First, let's go through the biography of Carl Rogers. Carl Rogers was born into a devotedly religious family in Chicago suburb in January 8, 1902. He is the fourth of six children born to Walter and Julia Cushing Rogers. When he was 12, his parents bought a farm a short distance from Chicago, and Rogers spent his adolescence there. His father encouraged his sons to raise animals for profit. The venture aroused an interest in scientific agriculture and the application of scientific methods to farming. And Rogers intended to become a minister, but he gave up that notion and completed a PhD in psychology from Columbia University in 1931. By his third year at Wisconsin, Rogers was deeply involved with the religious activities on campus and spent 6 months traveling to China to attend a student religious conference. In 1942, Rogers entered the Union Theological Seminary in New York with the intention of becoming a minister. While at the seminary, he enrolled in several psychology and education courses at neighboring Columbia University. Rogers was influenced by the progressive education movement of John Dewey. His life would now take a new direction toward psychology and education. In 1927, Rogers served as a fellow at the New Institute for Child Guidance in New York City and continued to work there while completing his doctoral degree. At the institute, he gained an elementary knowledge of Freudian psychoanalysis, but he was not much influenced by it, even though he tried it out in his practice. He also attended a lecture by Alfred Adler, who shocked Rogers and the other staff members with his contention that an elaborate case history was unnecessary for psychotherapy. Rogers held numerous academic positions in various universities and made a significant contribution in each. During his early phase of his professional career, Rogers was strongly influenced by the ideas of Otto Rank, who had been one of Freud's closest associates before his dismissal from Freud's inner circle. His lecture provided Rogers with the notion that therapy is an emotional growth-producing relationship, nurtured by the therapist's empathic listening and unconditional acceptance of the client. And in 1940, he took a position as a full-time professor at Ohio State University. Later, he held positions at the University of Chicago and the University of Wisconsin. A year before, as part of the war effort, Rogers moved back to New York as director of counseling services for the United Services Organization, where he established a counseling center and was allowed more freedom to do research on the process and outcome of psychotherapy. The years 1945 to 1957 at Chicago were the most productive and creative of his career. His therapy evolved from one that emphasized methodology, or what in early 1940s was called the non-directive technique, to one in which the sole emphasis was on the client-therapist relationship. Wanting to expand his research and his idea to psychiatry, Rogers accepted a position at the University of Wisconsin in 1957. However, he was frustrated with his stay at Wisconsin because he was unable to unite the professions of psychiatry and psychology and because he felt that some members of his own research staff had engaged in dishonest and unethical behavior. Rogers also applied the person-centered approach to world peace by training policymakers, leaders, and groups in conflict. Rogers resigned from WBSI when he felt it was becoming less democratic, and along with about 75 others from the institute formed the Center for Studies of the Person. He continued to work with encounter groups, extended his person-centered methods to education, including the training of physicians, and to international politics. During his last years, he led workshops in such countries as Hungary, Brazil, South Africa, and the former Soviet Union. He died in 1987 at the age of 85 because of heart attack following a surgery for a broken hip. Now let's proceed to the existentialism and humanistic approach. Because of the historical connection and partly because representatives of existentialist thinking and humanistic thinking have not always clearly sorted out their views, the connections between the terms existentialism and humanism have tended to be confusing for students and theorists alike. The two viewpoints have much in common, yet there are also significant philosophical differences between them. They differ in that existentialists take the position that we are faced with the anxiety of choosing to create an identity in a world that lacks intrinsic meaning. For the existentialist, there is nothing that we are, no internal nature we can count on. We are faced at every moment with a choice about what to make of this condition. The humanists, in contrast, take the somewhat less anxiety-evoking position that each of us has a natural potential that we can actualize and through which we can find meaning. The underlying vision of humanistic psychology is captured by the metaphor of how an acorn, if provided with the appropriate conditions, will automatically grow in positive ways, pushed naturally towards its actualization as an oak. The humanistic philosophy on which the person-centered approach rests is expressed in attitude and behaviors that create a growth-producing climate. According to Rogers, when this philosophy is lived, it helps people develop their capacities and stimulates constructive change in others. Individuals are empowered, and they are able to use this power for personal and social transformation. Nevertheless, both approaches share a respect for their client's subjective experience, the uniqueness and individuality of each client, and a trust in the capacity of the client to make positive and constructive conscious choices. They have in common an emphasis on concepts such as freedom, choice, values, personal responsibility, autonomy, purpose, and meaning. Both approaches place little value on the role of techniques in the therapeutic process and emphasize instead the importance of genuine encounter. The existential and person-centered approaches have parallel concepts with regard to the client-therapist relationship at the core of therapy. The phenomenological emphasis that is basic to the existentialist approach is also fundamental to person-centered theory. Both approaches focus on the client's perceptions and call for the therapists to enter the client's subjective world, and both approaches emphasize the client's capacity for self-awareness and self-healing. Moving forward to the person-centered therapy, let's discuss its periods in the development of person-centered therapy. So in first period, During the 1940s, Rogers developed what was known as non-directive counseling, which provided a powerful and revolutionary alternative to the directive and interpretive approaches to therapy then being practiced. Rogers' theory emphasized the counselor's creation of a permissive and non-directive climate, based on his conviction that diagnostic concepts and procedures were inadequate, prejudicial, and often misused. Rogers omitted them from his approach. Non-directive counselors avoided sharing a great deal about themselves with clients and instead focused mainly on reflecting and clarifying the client's verbal communications and intended meanings. In the second period, during the 1950s, Rogers renamed his approach to client-centered therapy, which reflected his emphasis on the client rather than on non-directive methods. In addition, he started the Counseling Center at the University of Chicago. This period was characterized by a shift from clarification of feelings to a focus on the phenomenological world of the client. Rogers assumed that the best vantage point for understanding how people behave was from their own internal frame of reference. He focused more explicitly on the actualizing tendency, which will be discussed later, as the basic motivational force that leads to client change. The third period, which began in the late 1950s and extended into the 1970s, addressed a necessary and sufficient conditions of therapy. A significant publication was On Becoming a Person, which addressed the nature of becoming the self that one truly is, an idea he borrowed from Kierkegaard. In this book, he described the process of becoming one's experience, which is characterized by an openness to experience, a trust in one's experience, an internal locus of evaluation, and the willingness to be in process. During the 1950s and 1960s, Rogers and his associates continued to test the underlying hypothesis of the client-centered approach by conducting extensive research on both the processes and the outcomes of psychotherapy. Rogers and his associates at the University of Chicago conducted research to identify the ingredients in psychotherapy that account for therapeutic change. The client-centered approach emphasized the role of the therapist as a facilitator of growth and honored in the inherent power of the client. Research findings consistently supported this approach, confirming that therapeutic change is due to personal and interpersonal factors rather than to specific techniques for curing specific disorders. The fourth phase was during the 1980s and the 1990s, and it was marked by considerable expansion to education, couples and families, industry, groups, conflict resolution, politics, and the research for world peace. Because of Rogers' ever-widening scope of influence, including his interests in how people obtain, possess, share, or surrender power and control over others and themselves, his theory became known as the person-centered approach. Although the person-centered approach has been applied mainly to individual and group counseling, important areas of further application include education, family life, leadership and administration, organizational development, healthcare, cross-cultural and interracial activity, and international relations. During the 1980s, Rogers directed his efforts toward applying the person-centered approach to politics, especially to efforts related to the achievement of world peace. Moving forward to the key concepts of person-centered therapy, its view of human nature. First concept is the basic sense of trust in the client's ability to move forward in a constructive manner if conditions fostering growth are present. His professional experience taught him that if one is able to get to the core of an individual, one finds a trustworthy, positive center. In keeping with the philosophy of humanistic psychology, Rogers firmly maintained that people are trustworthy, resourceful, capable of self-understanding and self-direction, able to make constructive changes, and able to live effective and productive lives. The second one, Rogers maintained that three therapist attributes create a growth-promoting climate in which individuals can move forward and become what they are capable of becoming. This includes congruence, or the genuineness or realness, unconditional positive regard, the acceptance and caring, accurate empathic understanding, or an ability to deeply grasp the subjective word of another person. According to Rogers, if therapists communicate these attitudes, those being helped will become less defensive and more open to themselves and their world, and they will behave in pro-social and constructive ways. The third one is the formative tendency, which states that all matter, both organic and inorganic, tends to evolve from simpler to more complex forms. Rogers believed that there is a tendency for all matter, both organic and inorganic, to evolve from simpler to more complex forms. For the entire universe, a creative process rather than a disintegrative one is in operation. For instance, complex galaxies of stars form from a less well-organized mass. Crystals such as snowflakes emerge from formless vapor. Complex organisms develop from single cells, and human consciousness evolves from a primitive unconsciousness to a highly organized awareness. Fourth is an actualizing tendency, which suggests that all living things, including humans, tend to move toward completion or fulfillment of potentials. Because of each person operates as one complete organism, actualization involves the whole person, physiological and intellectual, rational and emotional, conscious and unconscious. Because of the belief that the individual has an inherent capacity to move away from maladjustment and toward psychological health and growth, the therapist places the primary responsibility to the client. The person-centered approach rejects the role of the therapist as the authority who knows best and of the passive client who depends on the therapist's expertise. Lastly, emphasizes clients' abilities to engage their own resources to act in their world with others. Client can move forward in constructive directions and successfully deal with obstacles, both from within themselves and outside of themselves, that are blocking their growth. By promoting self-awareness and self-reflection, clients learn to express and exercise choice. Humanistic therapists emphasize a discovery-oriented approach in which clients are experts on their own inner experience. And they encourage clients to make changes that will lead to living fully and authentically, with the realizations that this kind of existence demands a continuing struggle. So that's the end of my topic, and these are my references. Thank you so much for listening and have a great day.